think about a doctor, the doctor you grew up with, the doctor your parents have, that's what primary care is. It's the person who knows you and knows your family and knows all your medical problems.
There's wide recognition of the importance of primary care to the health of our community. Numerous studies have actually shown that the number of primary care physicians in a community is directly related to the health of that community.
So primary care is a very efficient way of taking care of patients, where we think about the big picture, we think about how can we prevent disease in these patients, and how can we help them manage their own disease.
When I was a resident, I had almost weekly experiences where patients would present to the emergency department with end-stage complications of diseases that we could have done something about if we had gotten them access to primary care providers.
The primary care crisis refers to the shortage that we have right now in primary care physicians. That's been caused by a decreasing interest of medical students in primary care and disaffection by many of our primary care physicians because of low reimbursement for primary care and very challenging working conditions.
I think we're coming to realize that our primary care system as it's currently organized is not really meeting the needs of patients and is providing care in a way that's burning out providers in increasing numbers.
As a physician, I often get contacted by people who are looking for primary care doctors and think I can magically find some for them, but in fact, in today's environment, that can be very challenging.
HMS is deeply committed to the issue of human health and how, through our education and research and leadership functions, we can impact human health. So when we have a very important component of human health that is suffering, we naturally want to do something about it.
The Center for Primary Care is a very exciting new development that is a result of the Dean's vision as well as the generosity of an exceptional donor.
What the center is trying to accomplish is to strengthen the state of the field of primary care, both at Harvard Medical School and nationally. We want to create new programs for education of our students and trainees. We want to create opportunities for innovative care models to be developed and tested. We want to create the opportunity for new research initiatives in primary care, and we want to be able to specifically train the leaders of tomorrow in this field.
My hope for primary care in the future is to not just increase the workforce, but to bring in new thoughts and new energy. I think that working here at Harvard with the young clinicians and the really innovative clinicians that are already, in the field right now, has shown that there's so much potential.
I think the best way for the public to get involved with this new primary care center is to tell us what they want, tell us what they need, tell us what they wish they could have with their primary care doctor.